posted on my Instagram if there were any questions, and one of the biggest ones a couple of the biggest that were coming in, which you probably hear all the time, are the different toothpaste types. So xylitol, hydroxyapatite, prebiotic, probiotic, like where do you stand with all of these things?
Welcome to The Discerning Mother, the podcast for Jesus-loving moms who want to tune out the noise and tune into God's design for motherhood. I'm Brigid, a board-certified women's health coach, holistic health practitioner, birth nerd, and homeschooling mom of 5. I help moms to heal their minds and bodies, trust their instincts, and embrace the beauty of the way God created them. Here we talk about birth, hormones, motherhood, faith, and anything else. Let's go.
All right, welcome back to the Discerning Mother podcast. I'm so excited for this episode. It's something that I get asked lots of questions about, and this is not my wheelhouse. So again, really, really excited to be able to chat and just learn more about this. And so welcome to the show, Dr. Sharon.
Thank you so much. I'm excited to be here with you.
Yeah, for sure. Okay, so I would first love to just know like a little bit more about your journey, because again, I've followed you for a little while, so I kind of know what's going on, but can you share a little about your journey into holistic / biological dentistry and like really what that means to you, who you are? I know you're a mom and healthcare advocate, but yeah, just tell us a little bit about yourself.
Sure. Well, I was fortunate to grow up with my father as a dentist, and he was a very progressive thinker. He and my mom always had a very holistic view of health. We lived out in the country and grew most of our own vegetables and just had lots of room to play and roam out in nature. So that was a great kind of childhood start. And once I became a dentist, I practiced with my father, and we grew and developed together in really learning about how the oral health connects to the whole body. So when I became a dentist, I was a young mom, and I started to have a lot of illness that was hard to identify. And what it boiled down to ultimately was a really high toxicity of mercury in my blood and in my body. And in the 90s, when I was going through this, that was not very easy to identify, to get diagnosed, and to even have anybody help me get to that point. So I did find some doctors who were astute enough to make that diagnosis. And then I did a lot of work to try to remove that mercury from my body. It takes a long time. At least back then, it sure did. But then I had to decide, how am I going to continue being a dentist? Because the silver / gray fillings are mostly mercury. More than 50% of that material is mercury. So as a dentist, even if I had decided, not to place those fillings early in my career because I started to learn about the toxicity, but I also had to figure out how I could deal with the material safely, because still, even to this day, I'm charged with removing it from people's teeth all the time. So that's when I started to learn there are techniques and hazardous material protocols that can be used to keep everybody safe, primarily the patient, but also the dentist and the staff, from the airborne mercury that is generated when you go to grind out and remove those fillings. So that started me down the journey. There are organizations where dentists can go learn these techniques. It does take some training, some equipment, certifications, but I'm happy to say that for that matter, I was able to find a safe way to deal with the mercury, and I continue to have my blood tested. I continue to utilize kind of preventive things with chelation binders to continue to detoxify if I am exposed. But my blood work stays in a healthy range for that, But once I started learning about, here's a material that's commonly used in dentistry that holds all this toxic potential for everybody, what else is there? And it turns out there's all kinds of nuanced issues that I started learning about with other materials that are commonly used and products that are commonly used in dentistry. And once I started treating people a little differently in that way, it sort of takes on a life of its own, because it turns out a lot of people are very interested in how their oral health connects to their total health. And so it's been a long journey of learning, and my own dental story has lots of colorful chapters that is sometimes a little hard to tell in one little snippet, but I'm happy to say that now I practice in Denver, and it's a really gratifying part of my professional life, because I get to converse with my patients and really learn about their total health, what their goals are, what are their aspirations for their health, how might what's in their mouth be affecting any kind of chronic illness, chronic inflammatory disease, autoimmune problems, of course, anything like a cancer or a heart disease. All these things can have actually root cause that stems from the mouth area.
Thank you so much for sharing all of that. And do you know, like, I know you don't just get mercury toxicity or poisoning, but like, do you know, was that just from being a dentist or was that from something else as well?
We probably never know. There are different types of mercury that can be identified in the blood, and there are certainly other sources than just dental amalgam fillings, of course. We all know that a lot of types of fish can kind of harbor mercury in the meat of the fish and the flesh of the fish, I guess, and other things in the environment. It's a difficult material for Mother Earth to even deal with. Turns out that there's a lot of mercury that can be present in lakes and in rivers and groundwater and soil that comes from a lot of different sources. However, what we also know is that downstream from dental offices, it's in high concentration. So this is why at least our country, I think it's every state now, requires a dental office to have a capturing filtration system in their suction lines so that it's capturing the mercury before it goes into the city's supply of water. So it's interesting to me because everybody realizes it's an environmental issue, but somehow it's still allowed to be put in the mouths of humans. So it's like a contradiction that I've had to just realize, okay, it doesn't make sense. I'm going to do what I can on both sides,
For sure. Yeah, for sure. It is really this contradiction. And actually, I was just having a conversation with somebody who is a chemical engineer. And so we were talking about, somehow we got on the topic of fillings. And he has multiple mercury fillings because that back whenever he was younger. And I was like, oh, are you going to like get those removed or like keep them? And he said, why would I get them removed? Like, they're totally fine. I was like, are you worried about mercury toxicity or anything? And he was like, no, as long as they're capped and like done properly, then everything is fine. And then I started asking about like neurotoxicity and everything like that. And he just kept going back to like, mercury is safe. Like, as long as you're not like injecting it into your bloodstream or something, it's safe. It's not going to do any damage. What would you say to somebody who has that sort of thinking?
So there's a lot of science behind it. And one resource I would say for anybody who's interested, the IAOMT website is just filled with, proof after proof, article after article, study after study about the issue of dental amalgams. And the thing that I would point to is like, I don't know, it's probably not around anymore, but when I was a youngster, my father was a dentist. The way that they mixed the mercury fillings was that you literally had a bottle of mercury and a powder that was some of the other parts of the alloy, and you poured them into the machine, and then you would mix it. Well, so as a youngster, I would go to the office and play with the mercury because it's such a cool material. It's liquid at room temperature. So it's very different metal than other metals. So it's picture if it's liquid at room temperature, it doesn't take very much for it to start to become basically airborne, a little bit of heat. And now the particles are becoming airborne. So, and then it's highly absorbed through your skin. So all those years of playing with it on the desktop or my dad's office, I'm sure contributed to my toxicity. Mm-hmm. But there's just no way to deny the toxic potential of mercury. And the fact that it's in an alloy in your mouth, there's still so much research showing that there's off-gassing of that material through stimulation. Anytime you're brushing, any heat that's in your mouth, and of course we eat hot foods, if you clench and grind at night, it might be a trickle effect, but it is cumulative, and everybody has different potential to detoxify from mercury. So it's possible with your colleague or your friend that it's not contributing a lot to his maximum load because he's able to readily detoxify. Mm-hmm. But many people just don't have that ability. We're really not meant to have that much of it in our being not have that much exposure, I don't think. So the only way to really know is to have your blood tested. And there are more advanced tests now than ever before. So if people are concerned, that's the easiest way to say, hey, is this a problem for me or not?
Yeah, that's so interesting. You actually made me just think of my mom used to have this necklace, and I used to think it was so fun to play with because it was like a little ball, and inside of the glass ball was like some sort of clear liquid. I don't know what it was. But then there were
Okay.
mercury like traces.
Wow.
And I remember it was an old necklace, like old.
Yeah.
And I remember playing with it and being like, "This is so cool," because you could like turn it and like everything. And then
Yeah.
one day it actually broke, and there was like little balls of mercury all over the place. I'm like, "How do we clean this up?"
Yeah.
Yeah, talking about
Well,
properties of it just reminded me of her necklace.
well, if there's a spill, it's highly considered by OSHA to be a complete hazard. So
Mm-hmm.
one of those little mercury thermometers that we used, at least when I was young, if that broke on the floor, which happened in my kids' school, they cleared the room. It was quite a cleanup. They aired the room out for days, and that's just this tiny little amount.
And we're putting this in our mouths.
I know.
How is this allowed?
Well, it's being phased out in many parts of the world. I do think the ADA has recommended certain age limitations and not putting it in pregnant women's teeth. You know, some restrictions, but I think it just takes so long for people to accept things that we thought were okay and they're not, and it just takes years and years to have it become mainstream.
Yeah. So just to wrap up the mercury a little bit,
Yeah,
I know for sure whenever you like say you want to get the mercury removed, there are special procedures and techniques for doing that. So like you should not just go to a standard dentist who does not have this training, right? And so maybe can you just give a little bit of info in case listeners have these fillings and they want to get them switched out? Like what should they do?
well, the thing is, when you start grinding it, we have techniques of how to grind it out that minimize how much of it becomes small particles that are the ones that we can inhale or swallow during that procedure. Even in the old days, I have so many patients who said, "Oh, I had my mercury fillings out 20 years ago," and we'll talk about it. And maybe they didn't have a trained dentist, but their health was okay afterwards, and at least they got them out. But for people who are at all concerned about the toxicity, there's so many layers of protection that can happen during that procedure that really do. The IAOMT has done extensive research on every element. There's going to be different suction and protection placed in the mouth, a rubber dam and a high volume suction in the mouth. The dentist has certain, like I said, we work to bring it out in larger chunks rather than just grind it all up into tiny particles and suction it out that way.
Mm-hmm.
There should be an external suction device by the patient's head, it looks like a big elephant snout, but the suction's right here. So anything that isn't captured by our intraoral suction is captured by that big device. It's all meant to filter out mercury that goes airborne. The dentist and the staff typically in that environment are going to be very garbed up and protected with particular types of respirator masks that filter mercury. So there are lots of layers to it. And then once the mercury's out, the whole room gets aired out and cleaned. The surfaces are cleaned before the procedure continues. So it adds some equipment, some time, some cost. But most of my patients gladly accept that because they're coming to me because they want to minimize their future toxicity, not add to it. So, and I would say by my own health and my own metrics and how I measure my blood, I think anecdotally, it's all pretty effective.
Yeah, for sure.
Those protocols do seem to work for me at least, but yeah.
Yeah, I guess before we move on really quick, like what are some of the symptoms? I know it's going to vary person to person, but just generally, What are some of the symptoms if somebody is like having mercury toxicity?
It could be all over the map because it's a very potent neurotoxin at certain levels, but overall, it's going to contribute to overall inflammation. And so the times that people become symptomatic, in my experience, would be general fatigue, a lot of times like hard to diagnose headaches, anxiety, depression, just overall feeling crummy. It can ramp up from there in terms of then the immune system goes a little bonkers and different. It can be a contributor to lots of different autoimmune problems. And if it's left in there for years and people aren't detoxifying well, I think it can just contribute to all kinds of chronic disease. Yeah.
Okay, well, I want to shift gears over to, I posted on my Instagram if there were any questions, and a couple of the biggest that were coming in, which you probably hear all the time, are the different toothpaste types. So xylitol, hydroxyapatite, prebiotic, probiotic, like where
Sure.
do you stand with all of these things?
Well, it's a common question, and I agree with you. It's a hot topic. I have sort of a bias about that being such the big topic, because to me, the actual dentifrice, which would be the product, is the least important part of the oral care.
Okay.
It's one that we love. We love a good product. We love to be able to go watch on Instagram who's using what cool products. And to think that if I use that toothpaste, I have good oral health. So that's my first bias. Honestly, toothpaste is so new in human development. Was Procter and Gamble even around in early 1900s? No. How, I don't remember when they started making toothpaste. Believe it or not, the first toothpaste had, for a sweetener, it had sugar.
Mm-hmm.
So this whole thing, I mean, humans kept their teeth clean with mechanical means for eons before we had toothpaste. So the most important thing is the mechanical removal of that biofilm, the disruption of it on a daily basis, which is mostly mechanical. It's mostly, now we have good toothbrushes. They didn't have toothbrushes 200 years ago. They were using things from nature. There's lots of ways to mechanically disrupt the microbiome on your teeth. So that being said, since we are in the modern era and some of these products can be really helpful, a lot of it is like what to avoid. So you don't need soap and emulsifiers in your toothpaste that make it foamy. That gives it texture and consistency that makes it popular, but it's not really doing anything. And in fact, it can be a disruption of the actual complex microbiome that is in your oral environment. There's like you can have propylene glycol can be in toothpaste, glycerol, things that aren't necessary and can actually create sensitivities and GI disturbances. So I like products that have, I think nanohydroxyapatite is a really effective remineralizing product. Xylitol helps balance out the bacterial balance. Honestly, so I like Fig, I like Boca. There's some great products out there. There's a lot more emerging, sort of in the boutique brand sector. But a lot of my patients just make their own toothpaste. There's so many do-it-yourself ways with coconut oil and charcoal and maybe a little essential oil. The thing is, we grew up, at least my era, with Listerine and harsh products that are supposed to kill the bacteria. And it turns out you don't want to carpet bomb all the bacteria in your mouth. You want to disrupt the microbiome that forms on your teeth, because the bad players love to sit there and fester over a few days' time, especially in between the teeth, down under the gum line. So flossing is not popular, but it is, in my opinion, really, really helpful. Also, water picking is showing to be as efficient and effective, if not more so, than flossing. So if people aren't adept with flossing and don't like doing it, a really good water pick, using it down at the gum line, is very effective. So yes, that's my thoughts on that topic.
I have many questions. I was writing them down. So just the last one here. So would you say that flossing is actually more important than brushing?
I don't know if it's more important. There's a lot of broad surface on your teeth that I think is hard to get with floss. If you do a really effective job and angle your brush properly and take the time, you can get in between the teeth pretty darn well with toothbrushing. Picture, like, I don't know, for some reason I have it in my head, seeing National Geographic movies or whatever, where somebody who lives, in indigenous culture somewhere, and you'll see them hanging around just using things from nature between their teeth. I don't even know what it would be. So even kind of like some of these products that just, you can hold it and go between your teeth, it can be really effective. I've seen people that are in their 80s, they don't have any dental problems for decades now, and they use some of those old-fashioned picks, and that's how they clean their teeth. So I don't know that one's more important than the other.
Okay. No,
Yeah.
What you just said too about the indigenous tribes makes me think of Weston Price. And,
For sure.
Like, we have his big, or what's his big book called? I forget. Massive book. I forget what it's called. But we have, and my kids love looking through it, and they're like, their teeth are so pretty. Like, and then
I know.
What's wrong with these people's teeth? And it's just so funny to see how we've really been conditioned as a culture to be like, if you eat sugar, that's the cause of cavities. You need to brush your teeth 3 times a day to not get cavities. When in reality, it's like so much bigger than, obviously, like, there's some
right.
Cavities, but it's so much bigger than that. And it's like, and that's showing you that there's these cultures who, like you were saying, didn't necessarily brush their teeth, but they did other things. And they have these big, wide, beautiful jaws.
I know.
Topic. Like, their teeth are beautiful and straight.
And therefore their faces are beautiful.
Exactly.
Yeah.
I know. Again, that's like a whole other topic.
Well, I do think it's you're circling back to the proper thought process, because the whole issue stems so much prior to when we now think that the toothpaste is the answer.
Yeah, for sure.
Because it actually, healthy teeth are an inside job. So the actual mineral content that's available as your teeth are forming, and certain vitamins and minerals in the diet are so critical. It's especially important, in my opinion, to get the fat soluble vitamins in high concentration, that, like, the A, D, E, and Ks, which are most kind of efficiently brought in through animal products, animal proteins, animal fats. And so in those indigenous cultures, they may not all have tons of meat, but they utilize every part of the animal. You see the little ones crunching and chewing on hard things when they're just babies. They use the marrow, they use the bones to chew on. That stimulates the bones to grow. It stimulates the whole facial development. I don't know. I'm not an expert or a paleontologist, but like you say, with the work that Weston A. Price began for us and further research since then, it makes you realize the health of our mouths has been really affected by the modern diet, by processed foods, by the introduction of refined sugar in the diet, by the fact that we tend to, especially in Western culture, feed babies mushy stuff for years. I mean, at least I think in your world, I think your listeners are probably more advanced in their education about childhood nutrition. But in my era, it was sort of accepted that the macaroni and cheese, the hot dogs, the chicken fingers, those don't take much chewing. They go down the hatch easily. They're not highly dense with nutrition. And so everybody ends up with braces. Everybody ends up with wisdom teeth having to come out. This is new to humanity. This is not how we were designed. So yeah, it's very interesting, isn't it? How
it is. I was a product of that era of like mac and cheese, chicken nuggets, things like that. And I had to get all of my wisdom teeth out. Literally, he had to like chip them out because there wasn't even enough room to pull them out like individually. I had braces multiple times, retainer, all the things. And so what's interesting is that my kids now, we're doing things a little bit differently, where we found that, again, it's less important that their teeth are straight and more important, again, that jaw and like the development of the bone structure. And so like we're working with myofunctional therapists. They're doing all the things. We literally give them bones to chew on after like
that's awesome.
We make like a roast or whatever, even like this little one here, like that's the goal, is to like gnaw, to really work those muscles in those bones.
Right.
And then and then what I love is that we're obviously not in the same location, unfortunately, but I was able to find one dentist. He's not technically a biological dentist, but I was able to find one dentist who does work from the approach of like, basically, teeth are easy to move around. Like, let's not worry about the teeth.
Right.
He's more interested in like, let's get the jaw where it needs to be.
Mm-hmm.
We can move the teeth later on.
Sure.
And, like, we'd get the jaw where it needs to be through. He actually talks about nutrition. He actually talks about like these different exercises and things like that. And he's never. It's interesting, actually. Now that you mention it, he's never once told me about teeth brushing or toothpaste or anything like that. It's always just been like, let's get this jaw working how it's supposed to be and eating proper foods. Yeah, now that you say that, it's so interesting. He's never once mentioned it, and he never ever even gave like the little goodie bags that they give at the end with the toothbrush and like the Crest toothpaste. He never has given us one of those either. So, and now I'm just thinking, it's so interesting.
That's great. I think from a developmental standpoint, the way that childhood development grows, starting in really in the embryo, but then in infancy, and how the mouth is formed, those tongue ties and tethered oral tissues are, again, kind of a newer, ubiquitous problem in how human faces are developing now. But for you to have found a dentist who's very well versed in that and how to affect it in a positive way while the child's developing is huge, because I treat a lot of TMJ and bite disorders, and so many of my patients are maybe in the baby boomer generation. Sleep apnea is just almost an epidemic.
Yeah.
People they've had dental care their whole lives. They're kind of frustrated because now in their golden years, they're having to deal with a lot of these other sequelae from how the base formed. Everybody got braces. A lot of us had certain teeth pulled to make room because the jaws weren't big enough to hold all the teeth. And we're just sort of in a big conundrum right now with how to turn this ship around. So everything you're doing with the little ones, it's sad that we have to work so hard at it now, but at least you're giving them the best chance to have their face and their airway grow to be healthy and be able to sustain health throughout their life. So good on you for that.
Yeah, thanks. And I do just want to make a note for anybody listening. Yes, doing this myofunctional route is not necessarily like the easiest or the cheapest.
Right.
In the intermediate anyways. But long term, like it's going to pay off. And I can already see my daughter, her teeth came in like all gnarly because I didn't know any better until she was a little bit older. And she's still under that age of 12, so we'll still have time. But I can already see just doing the exercises and having her wear the appliance, and again the exercises and the food and everything that we eat. I can already literally see her teeth starting to shift, which is so cool.
That's awesome.
So cool. And again, that's just the cosmetic side of things. So like, what does that do for her airways? What's that doing for her sleep? Like all the different things.
Yeah. Well, again, I'm sure that your audience is well aware of the unbelievable layers of benefits of nursing, as long as you possibly can, about how that when the baby's nursing, think of all the hours that baby's nursing. It's literally stimulating the growth of the palate, the widening of the palate. I think a lot of the baby boomers I'm treating were bottle fed. And their upper jaw just didn't expand normally. And so then that's when all the braces came in. The lower jaw usually tries to develop to meet the upper arch form. So yeah, the trend toward more and more mothers nursing instead of bottle feeding, I think is going to help a lot. Yeah.
So what would you say if a mom isn't able to nurse and she has to use a bottle? Is there something that you suggest, or what would you
I don't know that I'm the expert on that, but I do know that anything that any kind of nipple on the bottle that helps make the baby have to work, rather than just the type of nipple that basically just pours the milk down the throat, is helpful and better than nothing.
Yeah. Actually, now that I think about it, I believe that I have found one. I forget exactly what it's called, but if anybody listening wants to know what this is, to know what the brand is, let me know. I believe it actually sits pretty far back in the palate.
Yeah.
And it forces them to suction like they would if they were nursing.
That's right.
And again, this is the only one that I've been able to find like this. So again, if any listener wants to let me know, I believe I have it saved somewhere.
Yeah, but you hit the important thing. All that sucking motion, the work they have to do through nursing, is what's stimulating the development of the whole oral complex. The tongue is working; it's expanding the palate. So I guess the best that mothers can do if they aren't able to nurse is just try to find the most anatomic products.
Yeah, for sure.
Like you say, the child has to work a bit to take in the nutrition.
So just to recap, which toothpaste you're using isn't a huge deal, as long as you're using that mechanical motion to disrupt things, especially using, the water picking, flossing, everything like that, is more important than the type of toothpaste.
In my opinion, yes. If you're going to pick one, chemical in the toothpaste that I think is super beneficial, it would be hydroxyapatite.
Okay. What about, so we actually use a pro and prebiotic toothpaste, so it doesn't actually have xylitol, hydroxyapatite, or any of those in it. We've been using it for a few years now, and no problems at all. Do you have any thoughts on those types of toothpaste that don't necessarily have those hot topic chemicals in them?
Sure. I'm sure they're great. I think the most efficient and effective way to get your probiotics and prebiotics is through what you're eating. Topical application of those, meaning what's coming off your toothbrush when you're brushing your teeth, is such a minimal contact every day relative to what you're taking in nutritionally. I'm sure it's great. I don't think it's essential, but if you like it and it makes your teeth feel good and you're staying healthy, then that's awesome.
Yeah, and the diet is for sure the biggest thing though.
That's right.
We eat pretty well. We obviously have some treats now and then, but again, we eat pretty well. That's the biggest thing for sure. Okay.
Yeah.
Well, and so let's talk about, I guess, toothbrushes, because this is one that I just had a friend ask me about, and I have no opinions or understanding or education on this, whether to use like a manual versus an electronic or electric toothbrush, especially for children. So do you have any thoughts on those?
So how effective any kind of technique is needs to be assessed. It's like anything else. You have to try some things and then take new data and assess how it's working. So so are you thinking mostly with children?
Probably just because I know a lot of moms are listening to this and
Yeah.
like, what do we do with the kids? What's
Well,
best to keep a toddler?
I have an overarching theme about this, which is any child, it takes years to develop the actual mechanical skills, the dexterity to effectively clean their mouth. So the earlier you can establish that this is something that you're going to get help with for a long time, the better. I've always thought it takes till a child's about 8 or 9 years old to really be able to effectively clean their mouth.
Okay, wow.
That doesn't, so but they should be practicing the whole way through, but maybe if you're doing oral hygiene twice a day, one of those times the parent really needs to do the job. So I know there can be struggles getting little ones to comply, but there's struggles with little ones to comply with a lot of things. So
Yeah.
it's one that is firmly and nicely as you can stick with it, because once they realize, okay, I'm not going to get out of this. My mom's going to get in there and brush at the gum line all the way around my mouth, and I have to hold open, and the better. So that's one thing with the little ones. And plus it gives you a chance to be looking in the mouth, seeing how things look. If you start seeing dark spots on the teeth, you need some assessment from a dentist.
Mm-hmm.
That being said, your dentist will also give you feedback. How effective is your technique? Is what you're doing working? Again, how people use different tools can vary so much. I've seen people that have been using a Sonicare toothbrush, this would be more adults, for years, but for whatever reason, the way they're using it, they have thick plaque down at the gum line, and it's causing cavities. So then sometimes with them, I'll just go right back to, let's use an old-fashioned manual brush and teach you how to actually apply it properly to do the job you're trying to do. And it can be vice versa. People just don't have the manual dexterity with a regular brush, and then we transition them to some more high-powered mechanical brush that can help them. It can be more important as people get older. Visual acuity goes down. Their ability to manipulate the things in their mouth can be affected with older age. I would say my biggest advice on that is continue to get feedback from your dentist and your hygienist about how it's working.
Okay.
So what no magic bullet.
Yeah. So what it sounds like is it's the same as toothpaste, where it's less about what toothpaste you're using and more about like the root of things.
Yep.
Okay.
I know it's not sexy to say that, but it's just what I've learned over the years. And maybe it could help young moms because you don't have to spend a lot of money on fancy oral hygiene products or devices. It could be as basic as just a good toothbrush from the grocery store and learning how to use it properly and just instilling the habit with your family.
Yeah, no, I love that because it is really easy to get kind of sucked into like the...
I know.
Like zebra toothpaste or whatever the new one is.
I know. I mean, we're all subject to that. Yeah, there's so many glamorous products with everything for care for our bodies, and yeah.
Okay, so I love it. Again, basically everything just comes back to like nourishing yourself well, supporting your body in a way that makes sense, and your body's going to do a great job with it if it has the tools that it needs. So,
amen.
Okay, cool.
Preach it, Brigid. I love it.
And so let's talk about like fluoride, especially in regards to cavities or, do you say caries? Is that a thing?
Yeah.
Okay, because I know that there's some who are like no fluoride, some who are okay with fluoride, whether that be in toothpaste. I'm thinking more specifically in like cleanings. But yeah, I'd love to hear your take on fluoride, and especially for use in children. Again,
I would direct people to the IAOMT website. They have a very well thought out official statement about the issue of fluoride that I think covers everything. And, it's a very comprehensive assessment of the issue. Generally, it's a fairly new thought process to introduce fluoride into the municipal water supplies. It was in the 90s when that started being introduced. I hope and think it was with good intentions, that it was going to be a mineral that was very deficient, that when it's in proper amounts in the human body, proper enamel can form. I think over time, some of that research has been maybe thought to be not as sound as we would have thought by what was put out there for us. So the problem is, once you compound now, pretty much universally around our country, people who were with any kind of city water were getting a pretty decent dose of fluoride. Even well waters were sometimes high in fluoride. But that water goes through now all of our beverages. All the bottled sodas and even bottled waters are made from that same water supply. So you just ingesting the water, you're getting quite a bit of fluoride. When you compound that with heavily fluoridated oral products, mouth rinses and toothpaste, it can be kind of overdosed. Now, I learned this in dental school. You can tell fluorosis on the teeth with different markings in the enamel that might be white spots or brown spots. That's pretty much proof that there's more fluoride than the body can actually accommodate and make good solid enamel. The beneficial elements of fluoride that make you stronger enamel, I'm not sure that has actually borne out as time has gone on. I question the validity of fluoride as being such a savior for dental decay. I think, again, I'm not really a researcher, but when I go look at the research that is well done and that's out there, I really question the validity of the anti-decay fluoride benefits. The other side of it is you can reach toxic levels of fluoride, and it does affect the IQ development of children when it's at higher levels. It can cause risk for different kinds of thyroid issues. I think we always have to weigh out risks and benefits. The enamel's actually made from hydroxyapatite. There's no toxic dose of hydroxyapatite, and it's, to me, a much more effective remineralizing agent than fluoride. It makes an actual proper matrix of the fluoride of the enamel that is more resistant to decay. And again, even more important than that is what's in the diet that helps the enamel form and all the tooth structure form through all the various variety of vitamins and minerals in the diet. So to me, people with problems of decay, a lot of times it's mineral deficiencies, it's vitamin deficiencies in the diet that body just didn't have a chance of making great enamel. So adding fluoride, to me, isn't really the logical answer. That being said, there are some benefits to fluoride as an application to desensitize root surfaces and different things like that. There can be, appropriate uses for fluoride. It's just like, I think we always do, especially in the United States, here's a good idea. Let's just take it to the extreme and go hog wild and put fluoride everywhere because it's going to be so great. Yeah. My own daughter I bought into it. I gave her fluoride drops when we were little. When she was little, we had well water. I was like, these kids are not going to have cavities. Mm-hmm. And she ended up with fluorosis staining on her teeth. And in high school, she was mortified by how it looked. Mm. To my regret, I did veneers for her to make the enamel look, make the teeth look prettier. That ended up as a long story, but the sequela from that, she's still dealing with as in her early 30s, that how it affected her teeth and her bite and her TMJ. And I did those veneers as well as I possibly could. They were good veneers, but the grinding on her teeth for that, she ended up with a root canal, or it messed up her bite. So I've been through the whole gamut of the issue of fluoride. I wished I hadn't over-fluoridated, and I wished I hadn't done veneers if I were to look back, So, yeah.
Well, I mean, that's really helpful. And again, regarding your daughter, it's really unfortunate that she had to experience this. But again, you were just doing what you thought was best with the information that you had. And that's all that you can do.
Well, thank you. That is all we can do. And then to me, the real sin of it is if we don't learn from it.
Yeah, for sure.
So if you have things that caused other problems, you made decisions, okay, let's just be realistic and learn from it, so that in our society and with our own families, we don't perpetuate things that, okay, we went too far on that one, let's rail back. Let's always just go back to nature. Yeah.
Well, I would say that you definitely learned from that. So again, it's such an unfortunate situation, but again, look at what you've, probably it's just one cog, but look at what you've done because of that.
That's so true, Brigid. It definitely changed the trajectory of how I work with my patients. No doubt about it.
For sure. So you mentioned root canals, and this is so interesting to me because I was just talking with a 7-year-old that I know, and she told me that she has to get one root canal, and she was serious. Like, she knows, like, she was not just making this up. She has to get one root canal, and then she has 4 cavities. So it's like, I didn't even know you could do a root canal on a 7-year-old. Like, I don't know. Can you just talk about basic, like, high level? What is a root canal? Is good, bad? How to prevent them? What to do if you've had one? Just general root canal information.
All right. You're getting all into it, Brigid. But this is for sure an everyday topic in my practice. So think about, most people don't, why would you understand what a root canal actually is until you have somebody show you literally what's happening to the tooth? Every tooth has a gorgeous nerve supply and blood supply that goes down through the whole root structure. And so when the nerve gets damaged because of bacterial infiltration from decay or trauma to the tooth, so nerves get damaged in teeth because you got bonked, you had an accident. The body has a real difficult time healing that because those tiny little teeth have microscopic nerve and blood supply, and it's hard for the body to mount a huge defense against trauma. Does that make sense so far?
Yeah.
So, like, your tooth can't swell. You can only get so much new blood in there. And so teeth can degenerate pretty quickly with that kind of trauma. So the nerve starts dying. That can mean a terrible toothache as it's dying. But it also becomes a focal point of actual infection because of the nerve and blood supply going away. So, it can abscess. It can be a very serious infection. The reason root canals are so popular is because in that degenerative process, when you extract or amputate the nerve supply and the blood supply, you don't have pain.
Yeah.
So mostly it was developed because people had terrible toothaches, and it's like, wow, I don't want to lose these teeth. We go and amputate the main nerve supply and blood supply. Well, the problem in my experience and in much of the literature that happens in the years to come is that that's still an organic body part, but it's now literally dead. It's a de-vital body part. It can be a very potent harboring focal point of all kinds of different anaerobic nefarious bacteria. And it's not just bacteria. It could be viruses and parasites and mold, different microbes that can still proliferate within the root complex, because we cannot sterilize that tooth because it actually has communication through these tiny little dentinal tubules around the root complex in and out of the bloodstream. So there's a lot of research. You could look up some of the work of Dr. Tom Levy. Dr. Nischwitz is a very popular biological dentist from, I believe it's Switzerland, who is talking about this all the time. So much research about taking these root canals out of people's mouths years later and studying what's present within that root complex. We in dentistry know that they're usually black-looking teeth. They often have a very distinct odor. And when you study them under a microscope, most of them are very full of a lot of anaerobic bacteria that really wouldn't belong anywhere else in the body. Maybe in gangrene limbs is about the only other place we would find it.
And we have that in our mouths?
Yes. And so if your immune system's really strong and your body somehow managed to sequester that tooth the best it can, maybe you could still have a long, healthy life, of course. Their health is about so many different things. But this one dead tooth could really be a seed point for toxic bacteria that emit, as a part of their toxicity, a lot of sulfur-containing compounds, different compounds like mercaptans and thioethers that really have a lot of neurotoxicity potential. So I think it's an appropriate treatment in certain circumstances for a period of time, but long term, I've just seen too many patients whose health got disrupted because of this, and it was very difficult for them to sort through why they have chronic illness. And finally, somebody directed them to look at what's in their mouth. And when they took care of the root canals, which means you have to have that tooth out, they were finally able to regain their health. But this is very much an alternative way to look at the oral health and how it connects to the rest of the body. The dental industry is, very much still a fan of root canals because of the benefits, which you don't have pain. You can still use that tooth. And there's still times when I recommend a root canal because it's the most appropriate thing for that patient in that moment. It's not like I'm totally against them. But long term, it's a risk that when you really want optimal health, it's one that, you just I feel like I have to talk to my patients very specifically about the actual risks and benefits, which unfortunately I don't think is well discussed that often. So
That's
patients that I see, they said, well, they just told me I needed a root canal. I
No,
needed a root canal. So that's an option. So what happened to informed consent? I'm confused about this because I was taught in dental school in the University of Michigan in the 90s. Every single thing you talk to a patient about, you need to give them options, discuss the risks and the consequences. Like that's to me basic medical obligation.
Mm-hmm.
But I don't think patients have been told there could be risks, and then they couldn't really make an informed decision. They just did what, trying to be good and do the right thing and got the root canal because that's what they were told they needed. And as it compounds with other health things over time, a lot of them sit there very deflated and discouraged because they were trying to do the right thing. And maybe they did in that moment, but sometimes it's just not the end of the story.
Well, again, what you said there, that there's no informed consent, which
Right.
is such a problem. So again, if the person wants to decide to have the root canal, knowing all the downstream effects, sure, whatever,
Right.
their decision. But if they don't even know that these things are a potential, especially for like a 7-year-old, like
I know.
like again, informed consent is so huge, and unfortunately, it's just not given. Nowadays.
Right.
Okay, well, I could ask you so many more questions, but I do want to be super respectful of your time, so maybe we'll have to chat again.
Yeah.
But I would always ask guests one final question, and that question is, what do you want the discerning mother to know?
Well, first of all, every mother is doing the best they can, and there's so much to tune into. Mothers want the best for their kids. So to add one more obligation as trying to make the perfect scenario for your kids on the dental side can seem overwhelming. And in an overwhelmed household, an overwhelmed mother, it is one of those things that can get down the ratchet list as far as like compared to nutrition and sleep and trying to get up and going in the morning for all the things that people have to do. So when you're doing everything the best you can and you have the capacity to really tune into your child's oral health, it's worth it because the nutritional aspect, introducing a wide variety of foods at as young age as you can, making sure there's a whole complex of vitamins and minerals, helping your kids have crunchy, chewy foods that aren't the most popular with little ones. You have to get creative, getting good dental care, getting good eyes on your kids' teeth. Good pediatric dentist is worth so much. It's great if you can find one that aligns with your philosophical views about health. Yeah. Those are rare. Pediatric dentists that align with your views of health. Sometimes it's you have to look, but it's worth it. And the most important thing is in the family that this is just accept oral hygiene care as part of your routines, like every other routine that you don't let go of unless it's just a rare circumstance. The earlier your kids just learn that that's just what we're going to do, we're not going to fuss our way out of it, we're not going to have a fit and get out of it. It's a hard line that I think if you can draw it, it pays off so much for your family's health, your kids' health. So that would be my overlying message.
Yeah, that's so good. Again, you're doing a great job, and yeah, to just like keep going. It's hard, but like just
it is.
And
I remember standing in front of the bathroom mirror with my kids on the counter. You're trying everything, singing songs, making it fun, sneaking it in there when their mouth's open, with an infant, laying the kid's head on your lap on the couch to brush their little teeth is a great way to start. There's all kinds of different, I'm sure in your community people share ideas, but just don't give up.
Yeah, for sure. Well, thank you so much. This was such a great conversation. Again, I have so many other questions, so maybe we'll have to chat later on.
Sure.
We appreciate you taking the time out and looking forward to getting this out so everybody can hear all of your wisdom. So thank you again.
Well, thanks, Brigid. It was really fun talking with you. I loved it.